Hi, I'm Dr. Dondee Nettles, and I'm going to be your answer man again. Today, we're talking about the MB, the mind body GLP-1 activation system, which turns on your body's natural production of the GLP-1 hormone. Now, are we getting, if you're like me, you're getting questions almost every day. If I have this problem or condition or medical diagnosis, can I take the product? And I'm just going to give you a partial list of what I have been asked personally over the last 9 days since this product has been released. Cancer, heart disease, stroke, diabetes, high blood pressure, sleep apnea, dementia, Parkinson's, metabolic syndrome, chronic kidney and liver disease, kidney dysfunction. All of those things have been asked of me personally. I have these things, or my prospect has these things. Can they take the product? Meaning, can they take the mind body product? Well, first, let me tell you, one, we can't answer the question as posed to us. Why? Because we are not medical doctors and we are not nutritionists, and those patients who are asking us are not patients of ours. So if we are not licensed medical doctors, if we are not licensed nutritionists or dietitians or herbalists, we can't, with any legal protection, answer the question. So do not put yourself in a liability situation where, let's just say somebody says, like, for example, high blood pressure. I have high blood pressure. Can I take mind body? Sure. And then the person takes mind body and something happens to them. Guess what? You're going to get sued. The company's going to get sued because you just gave medical advice because they asked you with regard to their, what did I say? High blood pressure. It's a medical condition. We cannot talk about conditions, medical conditions, and our products. We just can't. Don't go there ever, ever, ever. So how can we address the situation? So that's a great question. Who are you at? Let's go. Let me share with you how you can go ask your doctor about that, because they're concerned. They've got a medical condition. They are probably taking a drug for that. Or sometimes they say, I'm on this drug. Can I take this product? Great question, but not a question we can answer unless you're a dietitian and a medical doctor also, and the person who's asking you is your patient. If that's not in play, don't answer the question. Don't put yourself or the company in jeopardy. So let me share with you how you can get to the answer of the question. So let's use another one. Heart disease. I have heart disease and my doctor has me on this medication. Can I take mind body? It's a great question. Let me share with you how you can ask your doctor. Go to your doctor and say, hey, doc, as your patient suffering from heart disease, taking this medication, would it be in my best interest to improve my body's natural production of the GLP-1 hunger hormone? And simply let them answer the question, because you're not jeopardizing yourself or the company, and you're certainly not jeopardizing the doctor with that question. Because if the doctor is a medical doctor and they're also not a nutritionist or an herbalist or a dietitian, they can't even answer the question, because they don't have the license to do so. Medical doctors have less than 40 hours total nutrition on, or total education on nutrition, including in their residency. They're just not prepared for those conversations. So do not put them in a liability situation that may compromise their very ability to see patients and provide a living for their family. Honor them, and protect their malpractice. Don't ask them questions that could put them in a situation. So how do you do that? Ask the benefits of the product, not the ingredients or the product itself. So let's pick another one. Hey, doc, as your patient with dementia, taking this medication, can I take this mind body product? Don't ever ask that question, because the doctor's going to look at the ingredients, and maybe even if he or she gives you an answer, they just violated their very right to practice, or what is called their scope of practice, and probably put themselves in legal jeopardy. But the way you can honor them, honor yourself, honor the product, honor the company, say, hey, doc, as your patient suffering from dementia on this medication, would it be in my best interest to improve the function of my natural production of the GLP-1 hunger hormone? A doctor probably, if they know anything about it, and they probably do, because of all the medications that are out there, sure. They may even want to write you a prescription for one of those medications, but don't go down that road. So that's how you answer the question of the prospects that are asking you. And I'll pick another one just so we're on the same page. I have cancer. Can I take this product? Or I have cancer. Will this product benefit me? It's a great question. Let me share with you how you can ask your doctor that question if you're concerned about it. Go to your oncologist and say, as your patient with cancer on this medication, would it be in my best interest to improve my natural production of the GLP-1 hunger hormone? And leave it at that. The doctor will probably have the ability to answer the question. Now, if the person who doesn't have time to go to their doctor, they have to get an appointment to be able to ask the question, but they're asking you the question. Let's pick another one. I have sleep apnea. Can I take GLP-1 or the mind body? I think you're getting the picture here. Regardless of the symptom, regardless of the diagnosis, can I take the product? It's not an answer that we can ask. Ask your doctor if you're concerned about it, or ask yourself, would it be in your own best interest to have a better relationship with food? Can you see any downside to that? Any downside to less hunger? Any downside to less cravings? Any downside with an optimizing your experience and your relationship with food? And let them answer it, because we can't answer medical questions because we're not equipped to do so. There you go. Hope that helps. Have a great day. Take care. God bless.